Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're talking with Dr. Timothy Brand, a urologist with Baptist Medical Group, about the risks and treatment for prostate cancer. Next up, we're checking in on a new program from Habitat for Humanity that will help seniors make their homes safe and accessible so they can age in place. Lastly, we've got Margaret Takacs, owner of First Dance Ballroom, to tell us about the benefits of dancing and about an exciting upcoming performance. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's wide range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you. Prostate cancer is the most common non-skin cancer in America. In the United States, 1 in 8 men will be diagnosed with prostate cancer in his lifetime. Here to talk to us about the signs, symptoms, and treatments available is Dr. Timothy Brand, a urologist with Baptist Medical Group Urology. Thank you for being here with us today. So can you tell our viewers, what are the signs of prostate cancer that men should watch out for?
Well, thankfully, most prostate cancer these days is found through screening and early detection, so that it can be discovered before there's symptoms and at a point where it can be more dangerous down the road.
I see. So what are the screening recommendations?
Well, we recommend it to be a shared decision-making process between the patient's physician, whether it's primary care or their urologist. For men that are between the age of 55 and 69, I feel that screening is a good idea. And those men should be offered screening, knowing that they could have a survival advantage to early detection. And then the risk of screening is of over-detection and over-treatment, because there is a lot of indolent or non-threatening prostate cancer that's around. But we can differentiate the threatening cancers from the non-threatening cancers, and these indolent or non-threatening cancers can be managed with active surveillance and not treated aggressively. But then also for men that are between the age of 40 and 55, it's also worthwhile to offer screening, especially if they have a family history of prostate cancer or if they're at a genetic predisposition to prostate cancer, for instance, African American race. Also, those men at 70 and older may have an advantage to prostate cancer screening if they're particularly healthy and if they have a life expectancy that's greater than 10 to 15 years.
What types of screenings are available and what is done for early detection?
Well, prostate cancer screening is done through a digital rectal exam to palpate the prostate and to check for tumor nodules, and a PSA, which is a blood test. The prostate-specific antigen is a screening test that we use to check for prostate cancer. Depending on the results of these things, it's possible that a prostate biopsy or prostate MRI to detect for lesions on the imaging may be indicated depending on results.
So I've heard that PSAs can be unreliable and there's an over-detection problem with prostate cancer. Is that true?
Well, it's true, and PSA has gotten kind of a bad rap over the past few years, but the truth is that using additional information to calculate an individual's risk, like their age and ethnicity and family history, exam findings, and sometimes even obtaining an MRI, can make it a very powerful screening test and can lead to detection and early treatment to prolonged survival with an early diagnosis. And as I mentioned before, if we find indolent or non-aggressive appearing prostate cancer, usually we just observe it instead of treating aggressively.
Okay. Can treating prostate cancer jeopardize someone's quality of life?
Well, it can, especially in regard to sexual health and urinary health. But modern day treatments are a lot better at preserving the quality of life in these areas, whether it's a nerve-sparing robotic prostatectomy or state-of-the-art image-modulated radiotherapy. We've made a lot of progress in terms of helping survivorship after we treat this type of cancer.
So what causes prostate cancer?
Well, it's just kind of a combination of luck and genetics, maybe exposures, but also there is a documented association between Agent Orange exposure and prostate cancer, but it's a very common problem, and about 1 in 8 men in the United States will be diagnosed with it at some point. So we do recommend screening.
I understand that benign prostatic hypertrophy is one of the most common conditions for aging men. And can you give us more information about this?
Yep, so BPH, or as you said, benign prostatic hypertrophy, it's a very common problem. The prostate continues to grow as men age, and this can be obstructing for the urinary channel. Fortunately, there's a variety of different medications and minimally invasive surgical options that are available to treat these symptoms. And frequently we can improve urinary health by improving lower urinary tract symptoms with men with these types of treatments.
Okay. Thank you so much for sharing this valuable information with us today. If a viewer is interested in getting in touch with you, we have your office number and information on the screen, but are you accepting new patients, and is a referral needed to see you?
Yeah, myself and my partners are accepting new patients. We have clinics in downtown Pensacola at 9 Mile Road and also in Gulf Breeze. Some carriers require referral from primary care, and others allow direct appointment making, so we'd be happy to see you.
Okay, so it kind of depends on the insurance carrier for that?
That's right.
What would you say to somebody who is, maybe they have someone in their family, but they're just worried about getting that screening and getting that detection?
Yeah, I'd reassure them that, frequently, if there is a problem detected, the treatments are typically minimally invasive or easy to manage. I think that a majority of the time the screening is negative, and it can be very reassuring. But also now sometimes we can avoid a biopsy by just getting imaging of the prostate with an MRI. So I think it should be a very tailored approach for the individual, where they can weigh their individual risk for disease and their desire for early detection, and for a state to have management where there's a low burden of disease and an easy recovery.
And is there anything else you want to let people know about prostate cancer treatment or detection?
No, I think we've pretty well covered it, and I appreciate you giving me this opportunity to spread the word about screening and detection, and also to speak briefly about the options for treatment for lower urinary tract symptoms in men.
And we appreciate you giving us that information. Thank you. Coming up next, a new program from Habitat for Humanity that will help seniors age in place safely and comfortably. Stay with us.
If you're looking for a fun and exciting environment for your loved one, then L&L Executive Adult Daycare is a perfect fit. We offer social gatherings, physical activities, games, outings, and daily luncheons from Karen's Catering. We take a holistic approach to social stimulation and aim to enrich the lives of our guests. Let us help restore your loved one's mind, body, and soul. We'd love to speak to you. L&L Executive Adult Daycare. Big business love with small town feel.
The Reesburg Institute, Pensacola's Ear, Nose, Throat, and Voice Center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference. The Beacon at Gulf Breeze offers the finest senior living community in the area. We are here for your loved ones who need assisted living and advanced memory care services. Seniors will feel right at home with studio, one-bedroom apartments, a large dining area, a beautiful landscape courtyard, and even a salon. With professional staff and one-on-one care, your loved ones are our top priority. Welcome to the Beacon at Gulf Breeze. Welcome home.
Pensacola Habitat for Humanity is a nonprofit that has built almost 1,400 homes in Escambia and Santa Rosa counties since 1981. This organization works to make homeownership possible for members of our community through construction of affordable homes, financial education, neighborhood revitalization, and sweat equity. Now they also have a program to help older adults make their current homes safer and more accessible for their needs. We've got Blaise Moll and Betsy McDonald here to tell us more about this program. Thank you both for being here.
Thank you for having us.
Yeah, we're excited to be here.
So tell us about the overall Aging in Place program and the model that Habitat uses to implement this program.
Absolutely. So Aging in Place program is a part of our community development program. And the purpose of community development is really to stabilize neighborhoods and communities and keep homeowners in their home for as long as possible. That becomes increasingly difficult as you age. So the Aging in Place program is designed to keep seniors staying in their home for as long as possible through various modifications and a holistic approach that connects them to resources outside of their home and perhaps even outside of their neighborhood.
Okay. What is the assessment process like, and what is the eligibility for someone who might need this program?
Absolutely, that's a great question. So for the assessment piece, partnership and collaboration. So we will work closely with a healthcare professional, which might be an occupational therapist, social worker, or a nurse. They do the functional ability assessment. So they kind of let us know what the aging senior or adult needs in order to be there safely, to avoid those slips, trips, and falls, which are the primary way that an older adult could injure themselves and would have to leave the home. So that's the assessment piece. Now for eligibility, we serve households that are below 80% of area median income. So typically if you're on a fixed income or have lower income, you would qualify for our services. I think we'll talk more about the application process here in a bit, but all that information's on our website and our staff's happy to help.
Perfect. What are some of the specific repairs or accommodations that homeowners might be able to receive through the program?
Absolutely. So I mentioned slips, trips, and falls are the number one ways that aging adults have trouble in the home. So some of the modifications are specific to each homeowner's lifestyle, but they can include installing the lever door handles, ramps, rails, raised toilets, walk-in showers. So anything that can really make a home more accessible.
And this program is new to our community, but what are some of the successes from this program in other markets that we're hoping to see in this community?
So Housing Plus Aging in Place is a program from Habitat International, and it's been piloted in other communities in our nation. So some notable ones are Wisconsin River, Palm Beach County, South Palm Beach, and DuPage in Illinois. All of those Habitat for Humanity affiliates have had success in reducing falls in homes where Aging in Place was delivered. It also increased the older adults how comfortable they are in their home, among other indicators. So while we haven't had an official Aging in Place program in our community, we've done tons of wheelchair ramps. We've put in some rails.
Wow.
We've just done other repairs to homes. So we're excited to get this started.
Yeah. You mentioned some of the kind of broader impacts. What are some of the impacts or benefits to this program outside of just that actual repair modification?
Yeah, so this program is geared for long-term effects like reducing the amount of older adults that are in nursing homes and keeping them in the community of their choice. It's also geared towards reducing loneliness and isolation to improve mental health. It is designed to decrease falls and other ER visits and also reduce the strain on emergency medical services and social services. And another thing it's geared towards is preserving that generational wealth so it can be passed down to other family members.
Of course. So how can people reach out if they're, say, a caregiver or a senior homeowner that does need these repairs or modifications to make their home more safe and accessible?
Currently our healthcare partner is Council on Aging. Right now we're kind of just getting started. So clients will be referred to us from Council on Aging, and we're working on some other community partnerships too. So there may be other avenues in the future where folks can get involved in the program.
And we're so excited to partner with you on this and start getting those effects into our clients' homes, but we're also excited for a broader community impact when you're able to get those assessments through other avenues. So how can people get involved or support the program?
So we will be accepting volunteers to help out with aging in place modifications, and that can be just regular folks who don't know how to do anything. We will teach you to install some of these modifications, and we have great trained professionals at Pensacola Habitat. We have a certified aging in place specialist through the Home Builders Association on staff. We also would like volunteers for healthcare professionals. Like if you're a nurse, social worker, or occupational therapist and you'd like to volunteer, you can assist with functional assessments. And then if you want to get involved otherwise, you could make a donation to support the program, or we also have a corporate sponsorship level that is geared specifically toward community development projects like Aging in Place.
Okay, so anyone can come help do these modifications and repairs. You have kind of a training program for getting people involved in that?
We do on-site training, and also we have a volunteer orientation. So not all of the Aging in Place projects are eligible to have volunteers help on. So like the more specialized ones like tub cuts or raising a toilet or something like that, we would bring in a subcontractor to do that, and we would not be able to have volunteers help out on that. But things like wheelchair ramps, installing rails, that type of thing, we would love to have volunteers come out and assist.
Okay. Is there anything else going out with Habitat for Humanity that you want to let people know about, or how they can help, support, get involved, anything?
We have stuff going on all year long. So coming up soon, we have our Women Build that we are aiming to raise $100,000 to support the construction of a home for a female head of household. And we do that every year. We usually have around 100 to 150 volunteers that are helping us with that. It's a really great event. We accept volunteers all the time for our new construction and community development projects. We have our gala coming up later this year, and also a golf tournament. So
a lot going on.
Yeah, there's a lot going on.
Well, we appreciate you taking the time to let us know more about this program. Thank you so much for being with us. Stay with us. We're talking about the benefits of ballroom dance next.
Over 2 decades ago, TLC Caregivers partnered with the Council on Aging of West Florida to assist seniors with non-medical help to stay independent in their own homes. Our commitment to providing these services started in 1989 and has grown to aid people from birth through geriatrics. From a short visit of 2 hours to 24 hours a day. We're a proud sponsor of the Council on Aging of West Florida. We're TLC Caregivers.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
There are many benefits to learning and practicing the art of dance, including building strength in both the body and mind, as well as the mood boost and social connection of dancing with a partner. First Dance Ballroom is a Gulf Breeze-based studio offering ballroom dance lessons and classes to all levels of dancers. They're also hosting the upcoming performance, The Greatest Showcase, a dance display at the Sanger Theater that will benefit Council on Aging of West Florida and feature some of our staff and board on the stage. We've got First Dance Ballroom owner and instructor Margaret Takacs here to talk to us about the studio and the upcoming show. Thank you for being here, Margaret.
My pleasure, thank you.
First of all, tell me about how you got into ballroom dance and how you ended up opening your own studio.
I decided not to go to law school. I started dancing my last semester in college, and I was able to take dance lessons at a local studio. I became the dance director, and eventually I decided I wanted to do a little bit more, and I wanted to focus on wedding dances and charity dance shows. So I opened up my own place.
Okay, and so that's where the name comes, First
First
Dance
Dance
Ballroom. So you do a lot of teaching people that first dance at a wedding?
It's the first dance for weddings, but it could be just your first dance in general.
Mm-hmm.
A lot of people want to try dancing, but they're a little afraid to. They don't want to look stupid or flouncy whenever they're moving. So it could be their first dance in life.
Okay. Tell me about the Greatest Showcase and what people can expect from that performance. We're very excited about it.
The Greatest Showcase is based around the movie The Greatest Showman. Mm-hmm. It's a wonderful musical. Hugh Jackman's amazing. The songs are very, very strong. So you'll fall in love with the music straight off the bat. When you come into the Sanger Theater, you're going to be greeted by stilt walkers, an aerial hoop performer. Mm-hmm. Then you get into the Sanger itself, and we'll have Brennan Bones, which is a local band, playing for you before the show starts. And then once the show starts, it's a series of ballroom dancers performing local musicals, any of the songs that you love from your favorite movie soundtracks.
Okay, and we should say that is on July 30th at the Sanger, so you can get your tickets at Ticketmaster or the Sanger box office.
Yes, ma'am.
And it will feature 2 members of our staff as well as a board member doing a dance in that show. What made you decide to partner with nonprofits to make this event a benefit? Because I know you've done it a few times in the past as well, right?
Yes, ma'am. I've partnered before with Guardian Ad Litem as well as Ghost Coast Kids House. I believe that the more that you put out there that's good in the world, the more comes back. And so trying to help our local community in any way possible is all what First Dance is about.
I love that. What are some of the benefits of ballroom dance, especially for older dancers?
Ballroom dancing is a great workout. You're surrounded by music and you're getting exercise without feeling like you're going to the gym and putting a lot of weights on your body. The benefits of dancing is it will improve your cardiovascular systems. It will help with your bones, keeping them strong. It also improves your agility and balance. So for senior dancers, the balance is definitely a big issue. It also helps with your posture and your bodies. I've had students that were a little bit more elderly that had bits of slumping, and they were able to stand up and able to see better. Mm-hmm. It also helps with your memory. Ballroom dancing is a full body workout that really challenges your brain to think in different ways and put together a series of sequences.
Mm-hmm. There's definitely a mental physical connection going on.
Yes, ma'am, it's a puzzle.
So what are some of the different types of classes or lessons that you offer?
I do private lessons and group classes. So monthly we do things like Bubbles and Boots. So it's country western line dancing with a glass of champagne. And then we also do the private ones that are a little bit more specialized. If you're looking to go to bands on the beach to dance, there'll be different dances than you would for a wedding. So we specialize in creating whatever it is you need to do to feel comfortable dancing in public.
So you're going to be teaching all different styles of dance, Latin, line dancing, anything like that?
We do a lot of line dancing. We do like rumba, cha-cha swing, waltz, tango, foxtrot. Those are definitely ones for senior dancers that I focus on. It's a less impact dance. And if you're looking for some serious cardio, we do salsa.
Okay. And what do you hope people take away from the classes or lessons that they take at First Dance?
I want everyone to know that they can dance. Ballroom dancing sounds very scary, it sounds formal. When you walk in the door, it's the hardest thing. But I promise I'm only 5'2", and the only thing I'm going to tell someone is to do it again. So I really believe that everyone can learn to dance.
Tell me a bit about your dance career, because I know you've done all kinds of things in your dance.
I started dancing basics, and I was not very good at it. Everyone starts definitely from the beginning and works their way up. I enjoyed doing a lot of the Latin. I was a Latin finalist when I was competing with the Pro-Am division, so I had a pro partner. My partner and I, once I became a professional, we specialized in theatrical and cabaret. So a lot of the more dangerous stunts is what we did in our dances.
What would you say to somebody who maybe wants to take a class, or maybe they have a partner that they kind of want to drag to the dance studio?
I definitely say do it. Call the studio. I would love to get them in for an intro. The introductory lessons are designed to be one-on-one and very private. So if you're a little bit more nervous or you want to get to know somebody, that's the way to start. And just see wherever the dancing takes you, because everyone really wants to dance. It just seems really hard at first.
Definitely. And one last time, let's plug Greatest Showcase, time, date, details, date, what can people expect?
The Greatest Showcase is July 30th at 7 p.m. at the Sanger Theater. I do encourage everyone to arrive early so they can be greeted by the stilt walkers and our aerial hoop performers. Also to enjoy Brennan Bones, who will be playing a lot of your local musical songs.
What are some of the other performers that will be doing the dance routines in that show?
It's all my students. My students are dancing in the show. There is actually mostly adult performers in the show versus kids. A lot of people think when they hear a dance studio that is a lot of children performing. We only have one children's number, and they'll be doing Afro Circus. So they're all going to be a bunch of cats. We have a lot of students that are beginner students, and it's their first time performing. They'll be doing cha-chas and some rumbas. And then we have some of my more advanced students. And they do things like tricks where he throws his wife above his head and she spins in a flip. We have a lot of group numbers that will be a part of the show, and those are a lot more entertaining.
Gotcha. Well, we're so excited to be a part of it, and I'm so excited to see it.
Thank you.
Thank you for being here today.
My pleasure.
Thanks for watching. Until next time, enjoy life. You've earned it.
Don't wait. Communicate. Make your emergency plan today.